Mack here at MedPsych Health, and I'm sitting with my colleague Jason, and today we're really trying to help any newcomer to therapy acclimate to the process. What is it like? What's it about? How do you start? And how do you get yourself in the door for the first time? And quite honestly, I think one of the biggest things that affects people or that causes people to be so hesitant and nervous about the process or initiating the process is stigma. So Jason, how do you see stigma affecting newcomers to therapy?
Well, it's huge. There's a lot of aspects to it, and so as we know, stigma is a lot of negative attitudes towards therapy, what it means to come in and see a therapist. And look, it depends on somebody's experience, right? Like, what are their family values? What is their life experience? What have they seen in the media about what therapy is and what it looks like? And the thing that I encounter a lot is there's this sense of weakness. I'm coming in and I have to see somebody and share my problems. I have to be vulnerable with somebody else. And how does this work? Because it seems such this like mystical process. Where am I laying on a couch and am I just gonna be talking for an hour straight? You know, what have I seen? Or is it gonna be like a Good Will Hunting scene where they're just gonna hug me and tell me it's not my fault for an hour? There's a lot of different aspects to it, but I think when I see somebody for the first time, they're very nervous. They're worried about being judged. They're so worried about being vulnerable and bringing this to essentially a stranger, and worrying about that. And so one of the biggest challenges is obviously being able to just create an environment where someone's comfortable and relaxed and can share those things with you.
Yeah, I think the biggest point that I like to make right off the bat to establish that comfort is that this is a totally normal process. And it may not be normal for a lot of people. If you're a couple generations older than us, it may seem like a foreign concept. But the thing I say right off the bat is mental health, this process, this idea of trying to better oneself, this is so important. I mean, you would go to a doctor and enter into a transactional relationship to gain or get a service or have a service provided to you to address a health issue. Well, when we talk about mental health, right, we're talking about the brain, we're talking about an organ, we're talking about something that is in that medical realm, but it's something that requires a lot of tact and a lot of, understanding from somebody who can empathize, but also has maybe wisdom that you don't have access to, or that you haven't been open to in the past. So I like to, right off the bat, be like, listen, we have to look at it in the same as relational health, physical health, spiritual health, whatever aspect of our being that we need to address, there's a person for it. Mental health, that's us. That's where we start.
And look, it's very different. If you broke your arm, it's a lot easier to talk about that. It's very observable. It's easier to treat. You're comfortable going to a doctor for that. It's a physical illness or physical issue. But if you're depressed or you're anxious or you have some addiction issues, it's a lot harder to talk about because of the stigma, and it's not very observable. It's more internal. So there's this big aspect of, well, I'm okay with this sort of help, but I'm not necessarily okay with that kind of help.
And I think that stems from what I perceive as a cultural problem, which is that idea that asking for help is a bad thing. That not being able to figure something out is weakness, like you had mentioned before, or just that unrealistic expectation that you should just forge through it, just struggle through it. And you're sitting there like you're in sinking sand and you're stuck like trudging through this mire and this murky mire, and it's not that easy, and it gets exhausting and it fatigues you and it really drags you down. And all I can think about is like this analogy, and this is how I describe it to a lot of my patients, is that I want to be there to, I know it sounds kind of funny, but like walk you through pain, through whatever it is, hand in hand.
Absolutely.
And it's the idea like you think a bond of brothers, or a firefighter, dragging a buddy out of a building, not maybe a burning building, but you got your arm around them, and you're like kind of pulling them through, and you're able to be a crutch, but also an encourager, a cheerleader, whatever you want to use, whatever analogy you want to use that fits, go for it. But that's what we hope to be. We hope to be by your side. We hope to work through whatever it is that you're going through and lend our skills, lend our emotional capacity, lend our wisdom about things that, again, maybe you don't know to the equation.
Yeah, I always say to my clients, especially if you're a new client, you're going to be in the driver's seat. You know yourself better than anybody else. I am not an expert in you by any means. You should not believe I know more about you than you know about yourself. But I'm kind of in the passenger seat with you, and I'm going to be pointing out some blind spots for you and pointing out some things that maybe you're not seeing, or just kind of challenging to look at things in a different way. And everybody needs that, because we all know that there are times where we get so in our head, we kind of get lost in these negative thoughts or distorted thoughts or these ways of thinking and relating to people, and it's helpful to have that outsider perspective. But I mean, to your point earlier, it's such an individualistic society here. You know, we're taught to do it on your own. Success means that, you know, you're able to kind of tough it through and push through on yourself. Asking for help is a weakness, and that makes it very challenging for someone coming in and sitting on a therapy couch, because to some extent they have to admit that they're struggling with certain things and they couldn't do it all by themselves. But it's part of life to kind of be vulnerable, and that's what we kind of preach and we talk about, and that's how I kind of view therapy in that light.
Yeah. I think the second point that I tend to bring up with any new patient is that we're talking about emotions. We're talking about mental health, our feeling states, our moods, you know, different fears, insecurities. We're talking about a lot of vulnerable stuff, right? It's deep. It's not the surface level conversations. And I think in a society that's, you know, idolizing success and perfection and all these things, that's a really hard conversation to have with your friends, with your family, with your colleagues. And that's where we can enter in as a trusted confidant to have those conversations with you. The other thing I like to educate people about is that no one ever taught you this, right? You probably didn't go through a health class where they were doing like the mental health 101. Maybe there's some progressive schools out there that are incorporating that. Fantastic. Go for it. We're cheering you on. But for the most part, this might be all new. The idea of emotion regulation, the idea of combating negative thoughts, like these are phrases, but what do they mean? We don't necessarily understand that without some sort of education. And you could go to Wikipedia, you could go to YouTube, hopefully check out our channel, but you can go to sources to learn some of these things, but the actual application of the accountability of trying to, you know, implement a new skill, a new strategy, a way to go about solving a problem, it usually requires somebody else, a living being, to be a part of that process. And that's where, you know, I always say, hey, no one ever taught you this, and here I am, this is part of my role, and this is what I want to do to help you out.
Yeah, I mean, I always say, like, we're all human beings, and we're all going to encounter a lot of the same things in our life, right? Yeah. We're going to deal with happiness, we're going to deal with loss, we're going to deal with failure, success. Like, we are bound to encounter this at some point of our life, and that way we're all related. And it's funny because a lot of the stuff that we talk about, a lot of coping skills, I mean, some of them may be a little bit more complex, but a lot of them are very straightforward, sometimes common sense. Things that people may already know about, they just struggle to really apply it. And so it's not, again, like this mystical process where we're doing all these elaborate techniques that are so outlandish and out there. A lot of it makes sense and it's practical, and it's just a matter of like what's preventing somebody from being able to implement it and use it.
So another part of entering into this therapeutic relationship is the therapeutic relationship itself. And you know, we say relationship because it really is a dialogue, a connection between two people to talk about some really deep stuff. And, you know, not everybody, I should say, is going to be a good fit. And sometimes that's the biggest barrier to initiating therapy, or not knowing how you're going to connect with somebody might be the reason why you haven't sought out therapy. What if they don't get me? What if I don't like them? What if I feel judged by them? And yeah, I don't know, Jason, what do you think you would say about the value, the importance, and how to really figure out if that relationship is the right one?
It's a good question, and a lot of information out there will say that outside of like specialty, outside of technique that you're using, the most important aspect in terms of the positive outcome in therapy is your relationship with your therapist, bottom line. And, you know, I talk to a lot of clients, or, you know, when I used to work in, you know, program setting, making a referral, I always used to say, give your therapist at least 3 or 4 sessions, even if you're not sure initially, you're uncomfortable, allow enough time to build a relationship. And if you don't feel it after a fair amount of time, which I think like 3 or 4 sessions is probably enough, then you can consider other alternatives. But think about all the powerful and changing relationships you've had in your life, whether it was with a parent, a sibling, or like a best friend, like somebody that just completely gets you and you click with. Those have all been relationships I know for me personally that have changed me for the better and have been incredibly beneficial. And so I look at that aspect in terms of, client and a therapist kind of coming together being incredibly important, right? The relationship itself can be very healing because it's just somebody that feels like gets you, that you really trust with, that you click with. And if you feel that way towards someone else, you're going to be a lot more open to some of the feedback that you're getting from them. So that's why it kind of works really well, because not only are you looking forward to your therapy session because it's somebody that you really enjoy talking with and really enjoy your sessions with, and at the same time you feel like you're taking stuff from it. And so it works both ways.
Yep. And I think that's a really important point. I mean, you're taking something from it, and you're not contracting to get a best friend. You're not paying to come see a best friend, and we don't want that to ever be. We don't want to be seen like that.
Nope.
That really that limits and hinders progress. And one of the things that I think is so important is that yes, you have this therapeutic relationship, but we have goals for you in the same way that we establish goals with you. So while you may come in wanting to address one thing, as we get to know you, we start to envision, your best, and we begin to try to, point out where to go, what might be helpful, what might be something good to confront, something good to process through, and that's such a beautiful thing. And I think one of the things that we need to also talk about is when you enter therapy for the first time, this might be one of the only settings, or the first settings in your entire life that you've had true confidentiality. And you can't talk about therapy without talking confidentiality, simply because if you have a problem and you go talk to a family member, out of sheer concern and compassion, they may share that with somebody else because they can't handle it. They don't know what to do with it. They're not sure, what the next step is. When you come see a therapist, when you step foot and sit on this couch in one of our offices, you're entering into a confidential space. So yeah, we're friendly. Yes, we want to help you. Yes, we're excited to see you. We're excited to hear your progress. We're ready to deal with your pain. But it's all in confidence. And that allows you to be maybe more open and more free than you've ever been. It allows you to share things without any kind of judgment or consequence. I mean, besides the emotional, upwelling or whatever it brings out in you, no one is going to take it from here and go anywhere with it except you. And that, I think, is so valuable, because even a best friend, right, tells a spouse, tells a wife, tells a husband, who knows, and that's something that might be scary. And we want to speak, just as ethical practitioners here, that we value confidentiality and we do not violate that. And that's something that we want to put in place to create and cultivate a safe space.
Privacy is incredibly important, and think about what it's like for the first time being able to be truly yourself and share like these innermost demons with somebody else and not feel at all judged by another person. It's one of the biggest fears that everybody has, is I don't want to be judged. I can't be my genuine self. Like, we're constantly shifting and shaping and holding back. And because the confidentiality and the things that we put in place, like, you can come sit on a couch just like this and be completely open and honest with somebody else, and then feel good about it. And that really is what therapy is all about. Like, it's about that growth, and it's about like, okay, I'm talking about something that maybe I'm ashamed about and something that is really a demon for me, and I get to share and talk about it. And guess what? I have this like kind of reparative experience because I'm sharing it, and sure, the emotions are coming up and feelings are coming up, but I'm working through it with somebody else. And I think the thing with a friend at times can be, you might share that with a friend and they're just not necessarily trained to know how to respond to it. They might be open to listening and supporting you, but they might be like, oh crap, like that's pretty heavy. Like, yeah, that's awful. I'm sure you'll get over it, and you might get that from a friend. But when you have a therapist, you have somebody that you can trust, kind of in a sense like a way you can trust a friend, but somebody who's kind of trained and prepared to kind of walk you through it, like you said, bring you through it, and have you feel and just kind of relate differently to it. And that's really the key when it comes to therapy.
Yeah. And just to go back to the medical analogy, if you break your arm or you are coming down with the flu and you go into a doctor, it's their job, it's their role to address that, to bring healing to the ailment. And a friend might be open to listening, a family member might be sensitive, but we actually bring a set of skills and a professional repertoire of so many different trainings and techniques and things like that to this healing process. That's what you're buying into. That's what you're investing into. So it's all that, but also that professional, set of services. And that's so important, is that we are committed to being by your side and work with you to a place of healing. And that's something that I think a lot of people don't realize, that you're not just talking about your problems, but there is a deliberate attempt to take you from a place of understanding to that next place of healing. And that's what we're all about.
Yeah, it's actually one of the things that bothers me a lot so not necessarily from a new client, but you have a client who's coming in, an individual who's been in therapy a few times, and you start to talk about those experiences, and it ends up feeling a lot that they just kind of came into the office, they vented about that week, and it never went anywhere. They were just spinning their wheels time and time again. And those are the comments that I really try to pay attention to. And in fact, I am very transparent about it. I want to ask about somebody's experiences, not because I want to knock another therapist, but essentially what didn't you feel like you got last time? And if you felt like you're somebody who's essentially just spinning your wheels in therapy, sure, it's helpful to come and share things every week and break down your week and get it off your chest. But how are we moving from there? How are we improving? How are we growing? How are we pushing ahead? And for me, I just struggle with that aspect. I need to feel like I'm kind of helping you with your goal, and not necessarily just somebody that you're coming to and venting, and then that's it. Because then what do we see? We see the continual problems kind of pop back time and time and time again. Now, nothing has changed. Even though it feels good in the moment, you get a few months down the line and the person's coming back to you and saying, I don't really feel like anything has changed. Why? And that's something we really try to avoid and try to talk about.
An important part of initiating therapy, or something to think about if you're considering starting therapy for the first time, is that we need to come up with goals. We want to be present. So if you want to celebrate, we want to celebrate with you. If you want to unpack something that was really difficult from your week, we want to be there for that purpose as well. But it's also this idea of, how are we going to add something? What are we going to bring that you're going to take, apply, and benefit from? And that's where goal setting comes in. And I always tell people, when you are looking at therapy for the first time, go in with an agenda. Go in with a set of expressed desires for outcomes. What do you want to do? What do you want to see? I want to learn how to be my own self, my real self, not feel like I have to be somebody to appease this person, to fit in here, to whatever it is. And if that's a goal, we want to help you. And the cool part, and just to use that as an example, is that where therapy gets really fun for both parties, for us as therapists, but also for you as a prospective patient, when you start to see, wow, I'm owning my new self, I'm owning this identity, I'm learning how to be comfortable in my brokenness, or I love being more vulnerable now. It's allowing me to be more expressive and to share what I really think. So that's where the self-confidence improves. That's where you start to see being able to regulate and use emotions to inform decision-making and understanding. And that's just such a cool process. And that's just one of many things that you can come in and ask for and say, hey, this is what I need help doing. And we could go on, and we'll do more series, more videos in a series like this, just to unpack that further. But it's simply the idea that you can come in with almost any goal, and as long as it's safe and it's ethical, we can get you there. At least try our best to, And that's, I guess, the last point, and we'll close out here, is that you come in with a goal, and we're ready to meet you right there. But it's about the effort you put forward. And therapy is a beautiful thing, but we can't fix. We're not there's no mystic voodoo or anything like that.
Nope.
You have to put in the effort. So come in with expectations. Come in with goals. Be sure to ask and be prepared to do some work. I think that's one of the most important things, is that you got to be ready to put in the time, put in the effort, even when it feels uncomfortable, even when we start to go in and say, hey, you've been talking about this for a long time. When are we going to start to try to change something? That's where the work comes in. So it's a fun process. It's a great relationship. We love what we do, and we love to see people succeed and to really thrive. That's really what we have for you today. So please subscribe and check us out. Stay tuned, and some other videos will definitely be coming down the pipeline.